shall be discussing the sequence and relationships. So we have here both the Shang and the co-cycle. So Shang cycle is also known as generating or promoting. So magkakaroon ng pathology if there is failure to nourish the sun. No? So for example, if you have the earth element that cannot nourish the metal element, no? And it draws from the mother. So if the sun will draw energy from the mother, so there is definitely pathology. So it's basically parang it's hindi siya nagno-nourish actually, no? So nag-o-opposite. So for the co-cycle, which is controlling the grandmother, grandson, if you remember, nagkakaroon ng pathology if there is overacting and insulting. So let's take a look at and let's compare the generating from the controlling. So you just have to take note of the arrows. So sa generating cycle or the Shang, tuloy-tuloy, like it's like a mother and son relationship. Whereas in the controlling cycle, we have a grandmother-grandson relationship. Okay, pathological sequence. The first one is the insulting cycle. So this is where the controllee actually fights back, no? So for example, if you have a very, like wood is supposed to be controlling the earth, no? So pag mahina po si wood, instead of the wood controlling the earth, it is now earth controlling the wood because nga deficiency wood. So that's what you call insulting. And being deficient, this will now fail to nourish fire, obviously. So we have here a mother who is unable to nourish her son. The other one is overacting. So this is like the over-controlling. It draws from the mother. So for example, we have an excessive wood. It overacts on the earth. And the water will draw from the wood. Okay? So kasi excessive nga si wood. Of course, the flow of the energy would be from the one that is of a higher gradient to the lower gradient. Diba? So let's take a look at the pathological influences. For example, is the liver. Sa totoo lang, there are so many cases that involve the liver in our clinical practice, no? So let's take a look at the liver deficiency and also liver excess, puro wood. So for liver deficiency, the heart, kasi nga the heart is, so it's negative, so the heart will be drawing from the liver. Because liver is deficient, it cannot act as a mother. Okay, so the liver or the wood is supposed to control the earth. So this time, it's the earth insulting the liver because nga mahina po si wood. Okay, spleen insulting the liver. If with regards to its relationship to metal, the lung will now be overacting on the liver because nga the controllee, the one who is acted upon, is so deficient. Okay, and if you have the relationship between the wood and the water, if the liver is very weak, if the wood is weak or very deficient, the kidney will fail to nourish the liver. Kasi if you remember, the liver and the kidney, they have a give and take relationship, diba? So like the liver will have to depend on the it has to give back to the kidney, it has to nourish the essence, and the same way as the kidney is supposed to provide the yin to the liver or the blood, But in this case, you have a very weak liver. So you cannot expect the kidney kasi nga walang natatanggap from the liver. Okay, I hope that makes sense. Now let's go to liver excess. So syempre, fire. Yeah, of course, when there's too much liver energy, so there would be a lot of fire. So there's no like sobra, no? For the liver and the wood and the earth, if you have too much of the wood, we have wood overacting on the earth or liver overacting on the spleen. So you would be expecting weakening of the spleen. So there would be symptoms that are that go with it. And then we have the relationship of excess wood to metal. So metal is supposed to control the wood, but this time the wood is so excess. So the lungs will now be unable to control the liver. And finally, liver excess, relationship to water. So you will have liver drawing from the kidney. Okay? Kasi sobrang init ni liver. So that means it's a one-way thing, no? So mas nade-deplete yung kidney yin. Okay, so I hope that was not too difficult. Okay, so here, this is actually a summary of what we should all be focusing on, especially when we try to determine what is really the imbalance. No, all of these elements are present in the person. It's just that as we grow older, nagkakaroon na ng imbalance. So we would rank the elements according to its strength. No, of course, number one, like whatever you see, for example, if you have a liver person, it should be tall and slender, beautiful eyes, very ambitious, very forward driven. However, if there is some imbalance, you would see a person who is so irritable, whose blood pressure is high, the voice is too loud, yung mga ganon. So I think this just deserves, this is one slide that you need to really, to really treasure, because this can guide you with your diagnosis. Okay, and at the same time, with a proper diagnosis, you can formulate the pattern and also determine the treatment principle so that the patient will benefit. Okay, so to make it more interesting, you might want to take a snapshot of this this slide. This is where we get to score ourselves. So with regards to the kind of or the element that is so preponderant in our personality. Okay, we don't have to discuss each one of this. It's just that if you have this is a way of really determining what your best element is and what is the worst. Since all these elements are present in us, so we will have to rank the elements from 1 to 5. So yung pinakamababa mo na score will be the last one, and it's probably something that's very concerning, something that you have to really put a lot of effort in trying to bring back to balance. Whereas yung nasa una, ito yung medyo mga positive qualities mo. So I don't think we need to really discuss each and every quality of the element. It's now up for you to just take a snapshot or a screenshot so that you can have your own copy. Okay? Maraming salamat po.